absolutely there's masking, but there's all this conversation around masking and around masking being negative. And first of all, it is perfectly fine to have multiple aspects to yourself. We all have multiple aspects to ourselves. And there's time where we want to bring some of that forward more than some of the rest of it. That's not necessarily masking, right? That's reading the room. That's fostering that part of yourself in that moment.
I'm so happy today I get to talk to my friend, Dr. Carolyn Parcells. She is a pediatrician and her focus is on adolescents and young adults. And she is a luminary in the ADHD world. And I wanted to talk to her because she is fun. She has many expertise, and we will definitely have her back to the podcast for some of those other expertise. But today we are going to just talk about friendship and her experience with friendship. Okay, so I know you, Carolyn, as you're sort of like Carolyn 2.0, right? I know you as this adult woman who's successful, unmasked, right? Like I know that, Carolyn.
Yeah.
But I've been on things with you. I've been on panels where you mentioned that there was an alternative, original Carolyn.
Sure.
Who was different. Were you different as a kid? Were you more masked?
I actually no. I don't yes and no, perchance. So I was really lucky, honestly, in a lot of ways because, being a Gen X woman, okay, I was actually diagnosed relatively young. I was diagnosed at 17. I was still in high school, and I was diagnosed because a family member was diagnosed, who was, of course, a young boy. And my parents looked at it and went, hold on, this sounds familiar. So to back up a little bit, I went to an all-girls school. And so I'm combined type. I was very hyperactive. And because I went to an all-girls school, I feel like I did actually stand out more than I would have in another environment where there were boys around who were also hyperactive, right?
Absolutely.
So my challenges, which I actually think in some ways was a good thing because I was identified and given support earlier than I would have otherwise. On the other hand, it was harder because I was so different. That was kind of a challenge as well. But in third grade, actually, they wanted to hold me back a year because I couldn't pass those stupid speedy math tests.
Oh.
And I know, right? And my parents advocated for me. They got me a tutor. And I'm grateful for that. And they did push me forward, but not in a way that I think was inappropriate for me to move forward, right? But they did recognize I needed support. I was always in the lower reading groups, which was not great for my self-esteem. But I have always struggled with reading. And I still remember summer reading. I don't remember what summer it was, but I remember we had to read A Wrinkle in Time. And this is before audiobooks were really big. And my dad read it aloud to me.
Oh.
And but he had me sit. It was really sweet. He made me still look at the words and he had me follow with my finger and he read aloud to me. Now, what's fascinating is my father is not an educational expert. My father was in business. He had no idea. All he knew was that's what worked for him. And I was him. And so maybe it'll work for me. And it did. Right? And so I got a lot of support from my family. I did have social difficulties, and I'm sure we'll talk about that. But I was also super, super lucky that I found good friends early on who let me be me and loved me for me, to the point where when I did have those difficulties with other people, I don't think it affected me as negatively as it would have had I not had that core group of people who I knew loved me for me and who I could be myself around. So I did learn how to mask and I did have to mask, but I didn't have to mask in the environments that meant the most. And I don't think I didn't really understand or appreciate that until I got older. And in fact, I feel like the older I get and the more I'm in this community and in this area of expertise, the more I understand just how valuable and unique that actually was.
Yeah, I think that that's amazing. And it brings me to a topic. There's so many topics to talk about, but I'm also dyslexic. And one of the topics though I was going to say is I think that there's a tendency on the internet to sometimes say like typical people are the enemy. And one of my closest friends is very typical, very calm,
Yeah.
very serene, and she's been my friend for like 20 years, and she is absolutely somebody who's like, don't let them dim your light kind of thing.
Yeah,
I
exactly.
think that it's not that's the enemy, it's meanies who are the enemy, right? And I
Yes.
think that's really
And
important
meanies
to
can come,
remember.
yes, and meanies can come in all shapes and sizes and all neurotypes.
Yes, yes,
To be
yes.
fair, to
To
be
be
fair,
fair.
I do think we, as ADHD humans, we tend to have, well, we know this, right? That we tend to be a little bit more empathetic. We tend to be big feelers. We tend to have a bend towards social justice. But that doesn't mean that every single one of us is fabulous and nice and kind to other people, and that we can't be mean, and that we can't be petty. And, that can
Right.
happen too.
And Ari said something on the podcast that I just have been like saying all the time, like to the point where my kids are like, we know, we know. But like he said, if the culture is to always be on time, then maybe those aren't your people. And I've sort of expanded that to like, if they're mean, they're not your people. Like
Not your people.
some of
Yeah.
this isn't about your neurotype. It's about like, are people, when you had when your dad read Wrinkle in Time aloud to you, which is like the absolute sweetest thing ever. When my mom didn't put the kibosh on me buying, you just have to buy the tapes of the audiobooks for those of you who
Right.
are younger
Yes.
and don't know. And it was expensive, and my mom never limited me. She would buy me the tapes for my little pink boom box because she knew that I could remember a book if I listened to it, and I couldn't as well if I read it. And it also took me forever and a day at that time to read it. And so I feel like those things are so valuable, and it's really about like supportive people
That's exactly right.
versus
Yeah.
someone's neurotype.
Well, like, for example, when I think about like my core groups of friends in the various phases of my life, right? My core group of high school friends, I think I was probably the only one with ADHD. In my core group of friends from college, this is really fun. We're actually like, we were theater majors. Shocker, I know. Jazz hands.
Okay, you're a
and we're-
doctor, so that is a
oh my God.
shocker. I did not expect that.
It is such a great group of people too, because there's six of us, 3 men, 3 women. We've got a physician, a PhD linguist, a theater marketing head of marketing for a regional theater company, an Episcopal vicar, a retired Army major, JAG Corps, taught at West Point, and a now stay-at-home dad with a Dungeons and Dragons podcast who was in the touring company of Rent, and a high school theater teacher. This is this group of people. Now, what's really funny about this group is in college, I was the only one diagnosed. Now there's only one not diagnosed with ADHD. And then I look at med school and residency, and like my residency group of friends, I think there's a couple of us, but most of those folks are neurotypical. And actually that group, speaking of the reading thing, one of the sweetest things, and they didn't even see it as a big deal, which is part of what made it a big deal. We decided to start a book club. Now, this was really just an excuse to get together and complain about residency and have have time together. But they did pick a book. They picked a book every month. We typically didn't even discuss the book, but they only chose books that were available on Audible for me.
Oh,
And
that's
they
so
didn't even,
kind.
right? Isn't that sweet? And what made it even better is it wasn't a big deal. It was a non-issue. It wasn't a big deal to them. It was just like, yeah, of course we're going to do that, which made it mean even more to me because they weren't acting like they were singling me out or doing this great thing for me. It was just like, yeah, no, of course. We'll just make sure they're on audiobook too. Like, no big deal, right? And so yeah, so to your point, it's like I've had these groups of friends throughout my life with varying amounts of neurodiversity involved. And it's just about who's supportive and who gets it and or at least tries or wants to get it.
And I think there's a really important message there too, which is that I've had people who get it, who are supportive, who are like, oh, yeah, if you need an audiobook, fine. And then I've had people who basically let you know that, like, we chose this book for you because it has an audiobook. And, I feel like part of what I wish for people is that they get enough confidence and empowerment to say, that's not a good friend. To put shade on
Yeah.
you like that is not a good friend. To say,
Yeah.
of course, we're doing this because you're part of our book club. And if you need this, great. That is a good friend.
Yeah. That's exactly right. That's exactly right. Yeah. And again, I think and coming back around to like the people who do have ADHD or other neurodiversity versus, neurotypical people, I think that's one of the things that's again, having that balance, right? Because there are people in my life that I'm so grateful I have because they are neurotypical.
Same
And so
here.
they can help me with stuff. They can help me compensate for certain things. They can give me a different perspective, just like I can give them a different perspective. And then there's, going to the ADHD conference and just living my best life with all my humans for 3 days, and just having my soul affirmed, being surrounded by people who totally and completely get it. And so I think that's important too, but there's definitely a balance to be had, you know?
It kind of reminds me, because you're a theater person. I was a theater kid. Like, I was that little kid who's on stage at like age 3.
Yeah.
And I did theater all through high school, and it was kind of my existence. Like, my existence was on the stage. And a lot of my theater friends now are diagnosed neurodiverse. They definitely were back then, right? But I also had this group of like quirky, nerdy kids from my classes. And I definitely loved having both. And that was also a pattern that developed in college, where I had like sort of two groups of friends, and they each had something. And that's something, like you're mentioning, the conference, the International Conference on ADHD is what we're referring to, for those of you who haven't been. It's amazing. And you feel it is like being back in the theater. It is like being back in the theater. It's bawdy and funny, and everybody's laughing, and you feel that sort of kinship with people. And you've made videos, literally, Carolyn, on
Yes.
Instagram that like
Yeah.
brought tears to my eyes, because you so captured it.
Oh,
But I
thank you.
think, like, having those different sides of yourself, like, that does bring me back to that theater side of myself. And then I have this other side of myself it's not better or worse. And I wouldn't say it's masked. I would say it's like a different piece of my
Thank you.
personality.
Thank you. This is okay. I'm so glad you said that, because this is literally what was in my head as we were having this conversation is, absolutely there's masking, but there's all this conversation around masking and around masking being negative. And first of all, I think it is perfectly fine to have multiple aspects to yourself. We all have multiple aspects to ourselves. And there's time where we want to bring some of that forward more than some of the rest of it. That's not necessarily masking, right? That's reading the room. That's fostering that part of yourself in that moment, right? And then there's also times where, for better or for worse, adjusting for your audience is appropriate, right? Whether it's for a work
Absolutely.
situation, whether it's for a social situation, whether it's for your own benefit, whether it's out of respect for the person you're talking to or interacting with. For example, when I'm seeing patients, right? My full on me on full volume is very loud in every sense of that word, right? When I walk into a room, this is one of the reasons why I'm so grateful I did theater, because it taught me to read the room, and it taught me to read my audience and communicate the way I need to communicate for that audience member. So if I walk into a room and I see a kiddo or a parent or a situation where I'm like, ooh, if I go full volume, it's going to be too much sensory for them, and they're gonna kind of close in. Then I know, okay, I'm not going to not be me, but I can turn down the volume a little bit so that I don't overwhelm them, right? And I'm okay with that.
But, like, here's the thing. I know there's masking, and I know some people have to mask, and some people even have to mask around their family of origin, right?
And that's hard.
And that's hard, and it's
Yeah.
awful. But,
Yeah.
like, let me just say this too. what I appreciate as a patient is when people adapt, because I will tell you that there's also physicians who come in the room without empathy, without support,
Correct.
without whatever. And I'm dealing with a hard situation with one of my kids, and they don't read the room, and they don't, and their personality might not be very big and very loud and very theatery like ours, but it might be that their personality is very matter of fact.
Yes.
Well, you know what? Sometimes you can't do that with a kid who's just hanging on by the skin of their teeth and
Correct.
really is worried about something and whatever. You need to like read the room and say, I hear you, I'm listening to you. I don't think that's masking. I think, like you said, I think it's reading the room. I think it's adapting.
Adapting. I like that term that you use, adapting or adjusting.
Yep.
I think those are two much more positive terms than masking, because it also doesn't suggest that you're not being yourself or you're hiding
Right.
who you are, right? You're just utilizing the parts of yourself or your ability to modulate for that situation. And I do think I'm part of why I think I don't have quite as negative of a view of it is because I didn't have to mask when it meant the most. Meaning, I didn't have to mask with my family of origin. I didn't have to mask with my really good friends. I didn't have to even, if we're going to use more positive terminal, I didn't even have to adapt or adjust all that much. Of course, there's times, right? There's times where, I mean, heck, in our own families, right? If somebody is not at 100%, you're going to adjust for them, right? So certainly those things happened within the groups of humans that I loved and that loved me. But because I was able to do that other places, it made it less difficult and less hurtful, I guess, might be a way of putting it, when I did need to adjust or adapt in other scenarios.
Right. And your core, I mean, to me, part of masking is that you're masking your values, your personality, your humor, those like core elements that make you who you are. And you're not talking about masking those. You're talking about adapting and turning down the volume. I'm sure
Yes.
you still make jokes with patients. I've known you a little while, and I know you make jokes still, right?
Oh, yeah.
Right.
Especially my ADHD kids.
Right, exactly. That's still who you are. You're not pretending you don't have a sense of humor, which to me does happen to people. And I'm very sympathetic about it because I, like you, I think because I was in the theater, there were times when I definitely was the stereotypical ADHD girl. Like I was looking forward, I was thinking my own thoughts. I did not hear a word you said, but you didn't think I had a problem because I wasn't disruptive, right?
Right.
I definitely co-sign that, but I think part of what saved me was drama because every afternoon I had that.
Mm-hmm. I had, and you know what I had? So my mom, again, not knowing why, just knowing it worked. My mom had me very scheduled as a young kid. And it's not because she was, some sort of tiger mom or anything like that. It was because she knew she had to keep me busy. Otherwise, I'd drive her crazy. And so I was in a dance, I was in a music, I was in a sport almost the whole time. And then when I got to high school, the things that kept me on track and the things that kept me sane and helped me to frankly do well in school, I was a swimmer. I was a swimmer and I was a theater kid and I was a choir kid. So between those three things, it was boom, 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 and I always had something going on and something to keep me busy and a group to be a part of, right? That sense of belonging that is so critical that I think so many of us don't always get early on. And again, I feel very lucky that I did, again, both in my family and in my friends. But certainly that doesn't mean that everybody loved the passionate, enthusiastic human that I was at the time.
God.
Certainly not. Not all teachers, not all coaches, not all peers. Yeah, no.
Well, and you talked about being in an all-girls school. And I thought that's really interesting because we know so much now about girls and ADHD and how they are often, not diagnosed, misdiagnosed. And it's sort of funny that because you were with all girls, maybe you stood out more. I don't know. Do you think that that's true? Like you stood out?
Oh yeah, like a sore thumb. Oh yeah. And in fact, one of my favorite stories with my best friend, the neurotypical rule follower. Although I was neurodiverse, but still a rule follower. But
Me
I
too.
in first grade, we looked like sisters. We still look like sisters. We looked very similar when we were little. And I will never forget this. In first grade, I went running through the building past the art room, and the art teacher looked up and said my friend's name. So she was like, Leslie, you stop running right now. And I looked up at her and I went, yes, ma'am, and kept running. And my friend gets to the classroom and I was like, you're in trouble with Mrs. Mays. And she's like, what? Yeah. She was not pleased with me. I definitely stood out, sometimes in good ways, sometimes in not so good ways. I still remember a story in fourth grade where this was not one of the best relationships with one of my teachers. And I was sick one day. And one of my little friends called me in tears because this teacher made her clean out my desk and throw away all my papers because it was such a mess.
Oh, that's so mean.
Hmm? The cool part of that story, though, is that my dad went in to see this teacher and spoke with the teacher and the counselor. And for the longest time, I didn't know what was said. I honestly thought my dad intimidated her. He did not. But he went in and he told me he went in and talked to her. And I didn't have any problems with her after that.
Oh, Dad.
Yeah.
What
Yeah.
did you say? I want to know.
Like, oh my God. No. And it turns out he told me, he's like, no, I just went in and I just said, hey, clearly there's some issues here. Like, we want to work with you. Tell us what's going on and what we need to be doing at home because we don't understand why you did this. And we don't agree with this decision, basically. And apparently the school counselor was the one who was like, I'm sorry, what happened? Okay, thank you. We'll take it from here.
Ooh, sending her a little bit of a muffin basket.
So it wasn't, I mean, my dad they were trying to be very appropriate. They were trying to be very respectful. They always were respectful about, even when they disagreed with our teachers, they were respectful when they spoke to us about it. But what that did do was that I knew without a shadow of a doubt from that day forward, my parents had my back. They weren't going to let me get away with stuff, but they had my back. And again, that's something that I don't think I really, I appreciated. I didn't realize how much I needed to appreciate it until I got older and even became a parent myself. Right. But yeah, so I definitely had some challenges in the school environment. I had some bullying situations. I had some kids that picked on me at various points, not because I was at that school and then I was at another school when we moved out of state, and that one was a co-ed school, and then I moved back to that school. And got an excellent education, had a lot of support at both schools, actually, honestly, especially given the era that it was in. I definitely had some challenges with folks not understanding. And I had some, like I said, I had some kids who picked on me or bullied me, but not saying those things didn't affect me, but they didn't affect me as much as I think they otherwise would have because I had that core group and I had my family and I knew those people had my back. So it was like,
It's kind of a great lesson for us to remember, though, as parents of neurodivergent kids and as people listening who have neurodivergent kids, knowing your parent has your back. Even if they're not lucky enough to have friends yet, and that's something
Right.
we're working on or something.
Right.
I just feel like that is a huge piece that allows you, I mean, it's in resilience theory, that's part of it, is that you know that you can turn
Absolutely.
to someone and they have the skills and they will teach them to you. And I think that is just such a nice, powerful story, because your father didn't allow you to be shamed. He kind of took the shame bell away and like lifted it off you in a really, really interesting way, especially for that era.